Bismillahirrahmanirrahim. Please listen me carefully. I would like to continue the few important last topics of the this chapter, and I would like to complete the autopsy today. Inshallah, I am in position to discuss the rest of the remaining points in autopsy. I would like to take some more time to complete this chapter, and then I will start the exhumation, inshallah, after Muharram al-Haram. So your cooperation of the students are highly obliged. I'm sure that you are listening very carefully to me, and I would like to continue my topic of autopsy in communication with where I have to left this autopsy. And if you remember that in last time I have to discuss the internal and external examination of the autopsy and how we are going to start giving the incisions on the body, different incision for opening up for all three cavities. Because if you remember that I also talk about the in examination, they usually ask that which type of incision will you going to open a skull, and what are the types of incisions you are giving to open the neck area, chest area, abdominal area, and the pelvic cavity. So I think that it was clear last time, and I discussed last time this was my last slide. Now I am going to starting that after you are when you are completing the autopsy by collection of all the material as well as to complete all the incisions. I would like to collect and preservation during autopsy. This is my today's heading. That when you going to conduct the autopsy and you completing the autopsy, what are the requirements and what you are collecting and preserving during autopsy. This is a basic important things which you will need much more attention regarding when you are become a WMO, when you are passing your MBBS, and sometime you will be posted in some hospital side, and this challenge will be also accepted by you to do autopsy of fee, because according to 299C of the Kisasdiyat ordinance, the examination and autopsy of the female can be conducted autopsy by female doctor. So in every BHU Talca hospital, most probably the you are also given this chance to do autopsy. So be carefully to listen and find all these important things. Now, after you are completing the autopsy, then the thing is that what you want to collect and preserve during autopsy. So there are three area of studies from where we can collect and preserve some material to be sent for as the laboratories purposes and other the laboratories as well as to other departments for if you need any report, if you need any investigation. So the area of studies that after you are completing the autopsy, we are collecting and preserving from three area. Once when you have to remove the kilos from the body, something is to be taken from the kilos to be preserved, and the procedure is that the what you are obtaining from the kilos while they are on the body. Suppose if there is any foreign material, any hair, any grass, any mud over the kilos, so when the kilos are on the body, you can take something from the body, from the kilos. Number two, during removal, something when you are start removing the kilos by giving a stitch, cutting the kilos from stitches area, and if you obtain something from the kilos during removal, second stage is that. And number third is that when you are de-dressed, when you can take out the kilos from the body and you separate the kilos from the body, then you can wash you can place the kilos over a white sheet to see any foreign material on the kilo. So it means the things which are on the kilos during on the body during removal and after removal, you can preserve them and you can send for the examination. Number second, for extended scrutiny. When you are examining the dead body, when clothes are removed and when you do the external examination of the dead body, whatever you are obtaining from the external scrutiny, because in clothing you will obtaining either biological material, either non-biological material. Biological material, I talk about the blood stain, any stain on the kilos of the any mud, any stain of the oils or otherwise. So this contain two things. One is biological material and non-biological material. from the kilos. For example, on from the body, when you are doing external examination of the body, something can be identified from external examination from the body. Same thing can be transferred on the body. So what you have to obtain on external scrutiny when you are examining the dead body after removing the kilos from top to toe, from right to left, from anterior to posterior, you can collect and preserve them. And number third, on internal examination, obviously you have to cut the dead body, you have to open all the three serous cavities, so we can collect the material which are obtaining from internal examination. So three things of the important material can be preserved, collect and preserved. One is the fluids. When you are taking a blood sample, if you are taking the vitreous fluid sample, if you are taking the CSF, if you are taking any other seminal stain, so one are the fluids which we are taking for an internal examination. Either we are collecting the urine, stomach contents, see, these are the fluids. Then we are taking the visceras, all the visceras, routine visceras, starting from brain up to the pelvic cavity. We, we we are preserving all routine viscera. I'll discuss just a minute that how which visceras we are taking and how they are collected and preserved. So we have, once we are collecting fluids, number two visceras, and number third foreign bodies. Foreign bodies, suppose a person has got bullet in the body, suppose a person has got any pin, any other material or foreign body in the body, so they can be collected on the examination when you are doing the internal examination. So just stroke, you see the collection point is from kilos, from external examination and from internal examination. Now what we are preserving the material routine visceras. Let us see here. Now, routine viscera taken from during autopsy, we are taking the brain, so at least half of the each hemisphere will be preserved. Now, the for the examination, number two, when we are opening the thoracic cavity, you are preserving at least one lung and whole heart. So, by according to cavity wise, we are taking from brain half of the each hemisphere. When you open thoracic cavity, to take one lung, full heart with the coronaries, and then you come on the abdominal area. Then when you are opening the abdominal, the stomach along with its contents will be preserved, because the stomach will be ligated from the upper end and lower end, that is the pulmonary end, as well as the lower end is to be tied down by thread. First part of intestine, at least 1 feet to 2 feet of the first part of intestine should be preserved. Then another viscera should be preserved from abdominal is the liver, which is at least 200 to 300 milligrams of the liver, of liver will be preserved. Half of each kidney should be preserved. Spleen sometimes should be preserved, and as well as the contents of the pelvic cavity in case of the female, if it's a pregnant, the fetal parts should be preserved. So these are the routine viscera should be taken to be preserved in spite of the fluids. If there is a gush of the blood in peritoneal cavity, if there is a gush of the blood in the pericardial cavity, if there is a blood in the cranial cavity, now all these fluids should be taken and be preserved for the detailed examination to the concerned laboratory. So the routine visceras you are talking about, I talk about the routine viscera, which visceras which we are preserving. Sometimes they are asking in the examination. Now, how you are preserving is another thing. Types of preservatives to be used. Which type of preservative and what is the method of preservation of the visceras? Now, actually, the visceras are preserved by two ways. One is for histological examination, and second is for the chemical examination. When we are sending the visceras to the histopathological examination, we use at least 10% formaldehyde solution where we preserve the viscera. Take in a container. Now you can insert the 10% formalin and insert the heart or kidneys for the histopathological examination. So we have the areas. One is either we are sending the viscera for histopathological. When you use for histopathological use, preservatives uses formaldehyde, 10% formaldehyde. When we are sending the viscera for the chemical examiner, then we are using the saturated solution of salt or normal saline. Now it should be used to be preserved the viscera for chemical examination where we send for any poisoning, then we can preserve in normal saline or saturated solution of the salt. Now, third method is for preservation is to be freezing down. Sometimes we are sending the sample of the blood for DNA. So sample of the blood should be taken inside the test tube containing EDTA and should be freeze down. There is no preservatives used in case of the blood preservation for DNA. So either freezing system, either we have got normal saline system, either we have got histopathological examination, formaldehyde should be used to preserve the viscera. These are the preservatives sometime they can use to ask. Number fourth is another is the parcels. Now you see sometime we want to send the bones. Now you see this is the envelope containing some material. Now, sometime where are the material which are not to be sent in case of the container. Now we making the parcel. This is just a parcel. You are inserting the long bones, clavicle, or other viscera bones in the in this envelope. Sometimes we are preserving the material which are obtained biological, non-biological material. Is even the hairs or fibers from scene of crime. We can making the parcel. If we want to send a bone, smaller bone or longer bone, we making the parcel and we label all like this criteria, name of the deceased and the doctor's names as well as the time of the recovery of the material stamp to be sent for the concerned authority. So this type of either we maintaining preparing the parcels, either we are preparing the envelope, we are inserting certain materials. Then for this reason, we need containers. Containers where we are inserting the visceras. If you see that there are two types of the containers. Now this is the plastic made container and this is the glass made container. Now the difference is that once you are using this plastic made container where you are inserting the normal saline for chemical examination or you are sending for please now we are, now you listen me. Huh? Now look here, I am talking about the containers. Which type of containers is used for preservation of the material? Is that the glass made material? Please listen me carefully. Don't disturb, please. Now these are containers which are glass made container and plastic made container. The difference is that best choice is that you always use glass made container. Don't insert the visceras in this type of container because one can approach something they can insert through the needle because it is easily approachable to insert something inside the container when you are preserving some material, but one cannot approach through the glass bottle once you are preserving the visceras in the container with a fluid. So one cannot insert the needle and cannot mix something because some criminals can insert some poison to alter the diagnosis through the plastic because it is easily approachable. So best thing is that you choose this is a glass container and a glass container should be used for preservation of the material. And you can fill the container up to this level. You can left at least 1/3 of the container because for when you are preserving the viscera, the gases to be produced, or sometimes the bursting of the vessel is possible. So to escape gassing formation of gases, 1/3 of the bottle should be left empty. But you can not to be used like this type of the containers. Now, maintenance of chain of the custody is that the thing is that when you are preserving the material, maintenance of chain of custody is that collection should be proper, preservation should be proper, and sealing should be proper. Now, once you are collecting the viscera, then you are preserving the viscera in the containers with the preservatives. If you are not adding the preservatives, then sometime their autolysis took place inside the viscera, and the result comes negative. So even they can refuse, the laboratory technicians and laboratory can refuse you to say sorry that they are not to be doing the test because the material is autolyzed. So better thing is that collection should be proper, preservation should be proper, and third is the sealing materials that you can apply when you are inserting the lid. When you have to tie the lid over the bottle, it should be sealed by sealing material. Best thing is the celio type material. Plastic tape is to be applied, and then you can label the bottle regarding the material you are inserting. If it is liver, you are write down the liver over the bottle, and you can seal the properly, so one cannot open the lid of the bottle except in the laboratory. But best thing is that if you see the plastic of Paris, it is better that the you can wear, or you can wrap the bottle in plastic of Paris. Just we are wrapping, and it is preserved. One cannot be open the bottle in a very easily. So maintenance of chain of custody. Chain of custody is called as the collection, preservation, dispatch, and transportation. Collection should be accurately, preservation with preservative properly, and sealing material should be applied properly, and then you send through police. You cannot be hand over the material or bottles to the person, that they should have to go in the laboratory and submit in the laboratory, because they can do something wrong in between. So it is better when you are completing the autopsy, material should be collected completely and should be handed over to the law enforcing agencies. And through law enforcing agencies, they are going to bring all these bottles and submitting in the laboratory with the chit and receiving chit, and then the laboratory should be taken over all the bottles, and the report will be sent to the concerned party or concerned, that's pathologist who are sending the material. So this is called chain of custody, should be proper. Otherwise, any ambiguity, any material, any adding in these things can disturbs the maintenance of the chain of the custody. Sometime in examination they say, what do you mean by chain of custody? So chain of custody is collection, preservation, dispatch. CPD is another name. Collection, preservation, dispatch. Dispatch means transportation. Transportation is always through the police. Then we've got thing is the ancillary investigation. In spite of all these, if you want another need, sometime we can send the visceras or material for bacteriological examination, for enzymatological investigation, for the infrared photography, for the X-ray analysis, for other materials. So any other additional investigation is needed, should be sent all these things to the concerned party, and a report should be demanded on completing of the sending the material to that, then incorporated when you are making the result of autopsy, the opinion you are framing regarding the cause of death, all completing the receiving report from histopathology, from receiving report from chemical examiner, from other reports, bacteriologist, serologist, or the radiologist, then you can incorporate it in your result, and you're framing the opinion frame regarding the cause of the death. Now, this is the conclusion remarks. Conclusion remarks means what is your opinion, which I talked just a minute. When you are receiving all the reports from the concerned party, that I talk about the chemical examiner report from the chemical examination, histopathology from pathological department, and other, then you are framing the conclusion remarks, that what was the cause of death. So when you are starting making the paper or report, this is called as the conclusion marks, that which containing all the remarks regarding the autopsy, you have to be completed down, which include the external examination, internal examination, and the result you have to prepare. Because when you are gone through all these reports, you are making the final opinion, final conclusion, that what was the cause of death, why the person was dies away, what was the duration of the time since death. So whatever you are including regarding the cause of death, in your remarks, this is called as the postmortem report. This is called as the conclusion remarks, which is always prepared after receiving the reports from the where competent authority. Then you are giving the conclusion remarks. The certificate is already made. You are issue the death certificate regarding the cause of the death. Documentation. What are the role of documentations inside this autopsy? We are very clear, very near. Now there are two types of documentation. One is all those documents which you are receiving prior to work, and all those documents which you are sending after work. That is the post autopsy documents. Prior to work, you are read the police papers first of all. You must have to receive the police papers. Number two, FIR copy. Number two, you have got a dead body challan. You have got conditional documents. Conditional document is that either suppose you have got a death certificate prior. If you have got the hospital record, sometime hospital record is to be provided to you where the person was admitted. Sometimes you have got the surgical notes, you have got blood transfusion notes, you have got a tracheostomy, you have got notes regarding the surgery of that patient. So whatever the documents which you are receiving before you are doing autopsy, we call it as the documents prior to work. All these documents should be read very carefully before starting the autopsy, and after autopsy you can return all the documents back to the concerned authority from where you have to receive. So this is called as the incoming documents. The documents which you have received before your autopsy called as the incoming documents, which we call as the documents prior to work. Now, when you are sending the documents after completing the autopsy and the report, we called as the post-autopsy documents or outgoing documents, which also called as the after work. You are sending documents. All those documents which you received, first of all, number one. Number two, when you are preparing the report, autopsy report, this is also called as the post-autopsy documents, which are sending to competent authority, to the director of DG Health or any magistrate regarding the cause of death. These all documents which you are sending back to the competent authority, we call as the outgoing document. This is incoming documents. These are called as the outgoing documents. Now, this was all about the autopsy, but one of the important type of autopsy is still remaining. Sometimes they ask, what about the negative autopsy? What way you say? Because this was all about the positive autopsy when you conclude the cause of death. But if you remember, I discussed last time many type of the autopsy, where I talk about the medical autopsy, where I talk about the medico-legal autopsy, where I talk about something about mini autopsy. I talk about something about the immediate autopsy. I talk about virtual autopsy. I talk about psychological autopsy, and I last talk about the negative autopsy. So among all these categories of the autopsy, this is sometimes you will obtain a short note on negative autopsy, because the examiners are very tricky. Sometimes they talk about in the detail what you about the negative autopsy, their definition and their types and their reasons why you say the negative autopsy. So first of all, I would like to comment on the definition of negative autopsy. Negative autopsy, autopsy is said to be a negative. If you remember, I talked the definition when it's macroscopic and microscope findings. Macroscopic means the gross appearances. When you reveal nothing to ascertain the cause of death, on macro and microscopic findings, we call the autopsy is said to be negative. So negative autopsy is that when we cannot reveal cause of death, even on gross examination, even on microscope examination, reveal nothing to ascertain the cause of death, we called as the negative autopsy. When you certain the cause of death, we called as the positive autopsy. So negative autopsy is very famous when we cannot ascertain the cause of death on microscope examination and microscope examination to reveal the cause of death, we call negative autopsy. Negative autopsy is two types. One is the true negative autopsy and another is the pseudo negative autopsy. True negative autopsy is that there is actually the cause is lying, but the autopsy coming negative. Now, this is called as the true. There is a even 100% underlying cause, but a cause cannot be justified. We call this the true negative autopsy because we cannot conclude the cause of death. I'll talk the reasons. I'll discuss the true and pseudo negative autopsy in the detail. First of all, try to understand me the definition why I say true negative autopsy. True negative autopsy, in this case, there is a 100% underlying cause is there, but it cannot be identified by anybody, by autopsy surgeon. We call it the true negative autopsy. But in pseudo negative autopsy, pseudo negative autopsy is that autopsy there is an error in the judgment, and autopsy is said to be negative, and autopsy can nothing to reveal the cause of death. We can say, sorry, we are not asserting the cause of death. So basically there is a true where cause lie. This is error in the judgment. We call it the pseudo negative autopsy. Let us see the detail, the reasons for true and cause of the true negative autopsy and the pseudo negative. First of all, I would like to comment on the cause of the true negative autopsy. If you remember that there is an underlying cause is there, but we cannot justify it. Let us see here, very short time. Number one finding is that very short time. Now suppose if a person, there is a very short time between death and autopsy. So though if there is a very short time between death and you are doing autopsy, so there is no any significant change can be seen. Reasons is that what I am trying to say here. Now, suppose there is a vasovagal shock. Vasovagal shock is that when you are squeezing the testes, when you are squeezing the neck area where trigger zone is to be stimulated down. So, sudden vasovagal shock or sudden neurogenic shock, the time period is very short. So, there is no significant change apparent comes in the body. So, one can say the autopsy is said to be negative. Because if you squeeze the testes, if you are squeezing the neck area, trigger zone is to be stimulated down. If you applying the fist over the epigastric area, there is a solar plexus, and solar plexus is stimulated. Vagus nerve distribution is there, sometime leading to inhibitory response. Vasovagal reflect inhibitory vasovagal shock due to the stimulation of the vagus nerve on trigger area, so leading sudden death of the individual. So there is a very short time period between the death and autopsy, so there no any apparent significant change seen. So we cannot conclude the cause of the death, and we say the autopsy is negative, though there is a cause. Obviously, in case of esophageal shock, autopsy is negative. Why? Because there is no any organic change will be seen. There is no change in seen brain, no change in seen in the heart, no change seen in any organ of the body. We say the autopsy is negative, though there is a cause. Cause is the vasovagal shock, neurogenic shock, sudden squeezing of testes, stimulation over the trigger area, fist over the epigastric area, multiple striking over the neurogenic area, nerve ending stimulation, leading the vasovagal shock. Cause of death is there, but there is no significant change seen on autopsy. We can say the negative autopsy. Number two, no anatomical change. Now there is a cause, but there is no anatomical change will be observed on autopsy. This is second reason for true negative autopsy. Those there is a cause, but autopsy is coming negative. Why? Let us see here. One is the coronary spasm. You see sometimes sudden coronary spasm causing the acute myocardial infarction, and in some cases there is no any change, anatomical change seen in any area. Number two, sudden laryngeal spasm. Laryngeal spasm is that now you see here sometime we are drinking water. Now if you have seen many times when sometime one drop or two drop of water going in the larynx, we are starting coughing. What is why we are coughing? Because this is the water when we are drinking, sometimes few drops of the water go in the larynx area mistakenly, and suddenly there is a laryngeal spasm, and because of laryngeal spasm we are starting coughing. And due to sudden laryngeal spasm, if the coughing is more and striking on the laryngeal area is more and the laryngeal spasm is more, we call it as the dry drowning. One is the wet drowning, where a person merges in the plenty of the water in a river, and pool, and pond, and whale. We call it a wet drowning. But when a person dies away by laryngeal spasm because of two drops of water striking the larynx, leading to laryngeal spasm, This is called is the dry drowning. So even there is no the person is dies away because of laryngeal spasm, but a laryngeal spasm cannot be seen technically by naked eye. Similarly, the coronary spasm cannot be seen on naked eye examination. Now this is there is also, I say here, the change. There is a cause but cannot be seen. So no anatomical change will be seen in the body in autopsy. We say the autopsy is to be negative. It is the third cause of the true negative autopsy, cerebral concussion. Third cause of cerebral negative autopsy is cerebral concussion. Is that sometimes you have seen that when an striking of any some force on brain area, that is even skull area, there is a neuronal displacement from their area. But neuronal dysfunction lead transient ischemia in the brain sometime. Now, this is the neuronal displacement, cerebral concussion. Now, concussion is that when any striking of assault over skull is sometime leading neuronal displacement, and neuronal displacement causing sudden unconsciousness in the patient. And if as such a patient cannot be brought in the hospital to resuscitated, then he can immediately dies away. So cerebral concussion is that when is any striking on the brain, there is an underlying cause. But this a neuronal displacement, if it is to be managed early, person can survive. But if it is not managed early, then he dies away. Though only there was neuronal displacement, dysfunction of the neurons, which cannot be visualized by naked eye when you are opening the skull. So though there is an underlying cause, cerebral concussion is there, but autopsy comes negative because there is no any change seen in the brain matter. So we say negative autopsy, though there is a cause is the cerebral concussion. Number fourth is cardiopulmonary deficit. You have seen sometimes the old people during a scuffle, during quarrel. Now you see many times there is a dispute that took places in many pupils. There is a big quarrel took places between two people. Sometimes a slight strike. If a person is suddenly striking a smaller uh, force over the body, the person is dies away. Why? Because this person is old, already he was on compromising hurt, because he cannot tolerate even smaller lack of oxygen. You see some person without striking any material over the body dies away during quarrel, during dispute. What happens? This can happen in normal ordinary course of life. Many people, old people, can die away because of fear, sudden striking of many smaller light strike over the body, person dies away. There is no any severe striking, no any firearm, no any major strike on the liver, but a simple strike can cause suddenly person dies away. The reason is that externally you finding nothing, but it is to be suggestive that this person was already uncompromising hurt. Suppose he was personally already ischemic person. He has got some cardiac problem. He has got some cerebral ischemia, a heart ischemia. He cannot tolerate a smaller strike. So even smaller shout, smaller strike on the body, person dies away. Externally, you cannot finding any mark of violence, but person dies away. Now he can suddenly dies away. Why reason is that he does not tolerate smaller lack of oxygen, smaller lack of the striking. He was already on compromising hurt, so he can suddenly dies away. The autopsy reveals nothing to cause a certain cause of the. When you open the heart, when you open the skull, you open the any pelvic cavity, abdominal cavity, nothing can be identified. Autopsy is said to be negative, though there is underlying cause. He sustained only smaller energy because he was already on compromising hurt. He was old person. He does not tolerate smaller lack of oxygen. He can dies away due to disputed because a sudden stimulus over the heart area. He dies away, though there was underlying cause but could not be identified. And the autopsy we could call as the negative autopsy. This was the fourth cause of the true negative autopsy. Let us see here the causes of the pseudo negative autopsy. I talk about there is a error in the judgment. If you are not examining properly, and if is any error comes, you are in position to say the autopsy is negative. And always pseudo negative autopsy, there is a error in the judgment. Let us see here. The first of all, error in the judgment is that improper history. Now, suppose with the case comes to you, you are not taking the proper history regarding the cause of death, regarding the previous life of the individual. Now, because some person who have already has got some history of certain disease, and you are not taking history, you cannot conclude the cause of the death on autopsy table. So, because if there is a history of status epilepticus, you have not taken history. If there is a history of hypersensitivity reaction, you are not taking the history. If there is a history of pulmonary embolism, you are not taking history. If any example of air embolism, now you are not taking history. If there is any laryngeal spasm, you are not taking the history. So improper history taking reveals nothing to ascertain the cause of the death. This is the error in your judgment. You are not taking the proper history. It is improper history, resulting that autopsy is said to be negative. Number second, improper examination, that is lapse. You are not taking improper exam. You see, some person who are dies away have got multiple injection marks, who are addictive of certain drugs injecting in their muscle, in the forearm, especially in the heroin patient. Addictives are certain drug abusers who are inserting the needles, drugs through needles. So puncturing a mark, you are not properly examining the external area, the needle marks on certain area, you miss this point. Number two, the electrocution, that is the person dies away due to electricity spark light. Now you see autopsy coming negative because you have not properly examining. He has got a history of electricity shock. Electricity have to be on the body, but you cannot examining the area properly. Improper examination regarding the needle mark, improper examination keeping the view of electrical shock, and snake bite cases. Now sometime the person dies away due to snake bite, only the fang marks in the lower area or a certain area, you are missing this point. This is the error in the judgment. You are not taking the, this is the improper examination revealing the autopsy will be negative. We called as the error in judgment. Pseudo negative autopsy, another cause is the improper examination regarding the external examination as well as the internal examination. Regarding external examination, needle mark, snake bite mark, electrical current mark, you are not missing. And internally, pulmonary air embolism, now there is a laryngeal spasm. Internal examination is again, now you cannot conclude any cause of the death. This is the second cause of pseudo negative. Number third, histological cause of pseudo negative autopsy. Now this is there are two important factors in this case. Histological, what are the histological cause of pseudo negative autopsy? Is number one is the over freezing of a specimen. You are very confident. You have to place the specimen inside the defreezing system. They are over freezed. When they are over freezed, they lost histopathological architectural design of the tissue, and the cause of death is coming zero. Because this is the error in the judgment. You are in confidence that I have to preserve the viscera, but it is over freezed. Or if you are preserving the not preserving the viscera, you are placing the viscera without preservation, without preservative. Early autolysis, if took place inside the viscera, they destroy the histological findings in the tissue. So histological causes regarding the pseudo negative autopsy is the over freezing of a specimen, and early autolysis is coming in this case. Fourth cause for the toxicological error in the judgment is that sometimes there are rare poison which are the kits are not available in the laboratory, and laboratory himself they are denying upon to do the examination because of a lack of availability of the kits of the rare poisoning. Sometimes rare poisoning, like as nowadays still we have got a kala pathar. Now there is got no available non availability of the kits properly to detect the kala pathar.
or vegetable poison or other poison where the kits are not available. So due to this, they obviously give negative result, because non-availability of kits, they cannot do the examination and they give a result as a negative. And number five is, in this case, the improper training, unskilled autopsy surgeon. When they are doing autopsy, they are, if they are new, improper training, now they are missing a lot of the things, and obviously they make a error in the judgment regarding the cause of this. You cannot be justified because they are not well skilled, well trained autopsy surgeons. They can do blunder, and obviously they make result as a negative autopsy. Now, remaining is number six, regarding the cause of the pseudo-negative death due to sudden fright or shock. I talked last time that if is in certain area, hidden area, where trigger zone stimulation, there is a scrotal examination, that is excusing, and the solar plexus, if they are suddenly striking such area, they cannot examine it proper. They cannot, there is an error in the judgment, might be due to squeezing, might is to be due to the pressing over the trigger zone in the neck area, might is to be squeezing over the solar plexus in this area. They can miss the diagnosis and autopsy comes to be negative. Death due to the apparent insignificant trauma. There are certain hidden area, as I talked about last time, the injury in the umbilicus area, it is a hidden injury. Injury on certain axillary area in mouth, in other natural orifices, insignificant trauma in such area can nothing to reveal the cause of death, because autopsy surgeon cannot be examining these hidden area, and obviously when they do autopsy, they reveal the cause of death is zero. So the insignificant trauma, death due to apparently insignificant and sudden hidden area, where approach of the skill, autopsy skill, surgeon is not, autopsy surgeon is not skilled. They miss this thing, and autopsy obviously coming is negative. There are certain pathological lesions in the CNS where always naturally the death coming negative, like is the encephalitis, meningitis. Now, certain psychiatric problem, neurological problem of the brain, certain delirium, certain schizophrenic patient where if they dies away, they have autopsy coming negative. So there are certain pathological lesion which are naturally in the CNSs where cause of death cannot be revealed on autopsy. This is due to the error in the judgment. All these are causes of the coming in the pseudo negative autopsy.